I'd like to introduce Cindy from the USA, and Cindy has Crohn's. Welcome, Cindy.
Well, thank you.
Could you tell us a bit about your Crohn's, and when were you diagnosed?
I was diagnosed when I was about 25 or 26. So that was about in 95, 6, somewhere around there. And it came on very suddenly. I had never had any tummy problems or any symptoms prior to, I literally woke up one day and I went to go use the restroom and there was blood in my stool. And I didn't tell anybody for about a month because I just didn't. And I finally said something to my mother and she said, well, you need to go to the doctor. She said, that's a sign of cancer. And so I started my journey with the doctors, and at first they thought it was hemorrhoids, and then they said, then that was ruled out, then they said fistulas, and then that was ruled out, and then they said proctitis, and then that was ruled out, and then after about 2 years, and many doctors, they finally came up with the, diagnosis of Crohn's due to a biopsy from a colonoscopy. And so then, I've had it all this time with different degrees of being sick, and whatnot.
How did it actually affect you other than having blood in your stools?
Well, it got worse over the years. At first, I would always hear about all the stomach pain that you had, and I didn't have that for a long time. I just would have, very, very bad urgency. I'd have to use the restroom right away. Obviously the bleeding, and then sometimes getting really tired from, I guess from getting anemic. But then as time went on, it started getting worse and worse and worse, and I started to have a lot of pain, and it's severe fatigue. And I'm normally a very energetic person, so that was very crippling for me emotionally and as a person, because I'm not used to not wanting to do stuff or not feeling like I'm able to do stuff.
Yes.
Because normally I'm sort of hyper on the other end of the spectrum. That tired, it was hard for me. And, I used to work a lot in my younger years, in my 20s. I was really broke, and I had worked about 3 or 4 jobs, and I had a doctor tell me to stop working all those jobs because it was wearing me out too much with the Crohn's.
Did you have to watch your diet?
Not really. I've sort of got a different case, an interesting case. It's a little atypical than your average Crohn's. The only thing I've ever found that bothered me was coffee. I have been to tons of doctors. At one time I was a case study at NIH. Do you know what that is in Maryland?
No.
National Institutes of Health. It's like the government's premier, government hospital. Mm-hmm. And I was a case study there for Crohn's disease. And so I've been to all kinds of doctors. I've been to some of the best in the United States. And I've even tried holistic medicine. And I had a herbalist tell me one time to get off of coffee. He said coffee is very irritating if you have Crohn's. And I tell you what, I did, and I started taking a bunch of herbs. This is back about 15 years ago, and I was about 80% cured just from that. So coffee seemed to bother me. However, I love coffee with every breath in my body. So that's like the best reason for waking up in the morning. So I was off coffee for a couple years, and then I moved to Tennessee and met my husband, and he loves coffee, and he got me back on coffee. But then after I met him, I went through like an 8 months a year remission. It just happened. All of a sudden, he started giving me these oat bran tablets. I don't know if that has anything to do with it, if I was just very happy or whatever, but I went into remission for a long time. Mm-hmm. And then slowly it started to get worse again and on and off. But the worst it's been, I just came off of a really bad spell. All these years I've had it, I've never been hospitalized. I've never had surgery. I have never, mine is a little bit on the inoperable side as far as it's on the lower end of my intestines, so if I have surgery, it's going to be a colonoscopy bag, and that's it. That's the only option I have for me, which I never want to go there if I can help it. Mm-hmm. But my brother died very unexpectedly in 2009, and I took it very hard, and a week after his death, I came back from Maryland. I'm from Maryland. I came back from Maryland after the funeral and so forth, and I got very sick. And my daughter had been a little sick with like a stomach thing, and I thought I just had like the flu. Mm-hmm. And then I went for like 2 months like being extremely sick, but it was very different than any symptoms I've ever had with Crohn's before. My Crohn's was acting up, and I was bleeding and having all the urgency and all that stuff that I'm very used to. but I was having fevers and chills and no appetite and couldn't eat and things. I couldn't stand the smell of things, and I couldn't. At the end there, I couldn't even pick my head up off of a pillow. And finally, we all got a grip, and we realized something was desperately the matter. And they took me to a doctor, and they almost threw me in the hospital. It turns out I was having a Crohn's flare, which is very different, apparently, in symptoms to your regular everyday Crohn's. And so they put me. My doctor was very concerned. She almost put me in the hospital, but she put me on steroids and all these medicines, and said if I wasn't immediately better by the weekend, she was going to put me in the hospital. But I did. I rebounded really good, and I got better fast, and then I got manageable. The symptoms never went away, but I got a whole lot better. And then after about another 6 months went by, and I had another flare. But this time, I knew what was happening to me because of the previous one, and I knew the symptoms were the same. And so she put me now on oral steroids before I was on rectal steroids, the enemas that they give you. And I wasn't responding. Nothing was working. I was getting worse and worse. The bleeding was getting worse. I was getting anemic again. And she was getting ready to put me on Remicade, which, are you familiar with that?
No.
Remicade is a drug it's a relatively new drug in the treatment of Crohn's in the United States. It's sort of kind of like chemotherapy. It's like $10,000 an injection. It's very expensive. There is some evidence it causes cancer later in life. It's like the big guns for Crohn's disease.
Okay.
And I have never had a doctor ever even threaten to put me on that before, but now they were because I wasn't responding to anything. And I just so happened to talk to a friend of mine who is an old friend of mine. I've known him almost 30 years, and he's had Crohn's his whole life. He's had it since he was a little boy, 8 years old. And he told me about 2 treatments that were not your average everyday treatment, like a little alternative treatments for Crohn's. One was infecting yourself with hookworms. Have you heard about that?
No.
Okay, well, apparently if you do research on the internet, it's extremely effective. I was getting ready to do that, but it's very costly because there's a guy out in California that sells these hookworms, and you infect yourself because people in the third world countries do not have Crohn's disease. And so they think there's something to America and in other industrialized nations that are too clean, and it's wrecking havoc with your immune system. That's one thing he told me about. And the other thing he told me about was that he didn't know the name of it, but he said it was a pill that you take at night.
Right.
And he said, and that also regulates your immune system. Well, when I started really investigating via the internet all these 2 treatments, and I found out how much the hookworm thing was, I said, well, let me check out this pill. And I just quickly did, I used to do research for a living on the internet, so I'm sort of kind of good at it. And I quickly found out that it was naltrexone. Right. And I spent the whole weekend reading any and everything I could about naltrexone, and I called my doctor. Long story short, she had never heard of it and never knew anything about it, and she didn't want to give it to me right away, but she didn't say no either. And she checked with a doctor up in Vanderbilt, which is a big hospital up in Tennessee, and he said he's tried it with his patients, has never had success, but it can't hurt to try kind of thing. There's no side effects virtually. And she did, and she let me try it. And it has been a miracle drug. Within the first day I took it, the first night I took it, I was better the next day. Remarkably better.
But how long did it take you to get back to what's normal for you?
6 weeks or so, and I'm not taking anything now. And it's been almost a year, and I'm fine.
Wow.
For me, it has been miraculous. There's a symptom when you have these Crohn's flares. It's called foggy-headedness, and it just makes you feel like you don't feel clear. Like when you take a nap in the afternoon and you wake up, and it was a delicious nap, but you wake up and you're like a little out of it for a couple hours.
Yeah.
That's how I had been for months with the Crohn's. All the time, and I just never felt that's one of the symptoms, and I felt foggy-headedness. The first night that I took the naltrexone, the next day I woke up and felt clear-headed again for the first time in months and months and months, like a year. So that was the first thing that went away, and then I just slowly started to get better. I was taking a very mild dose of oral steroids too. You're not supposed to take a whole lot of steroids with it, from what I read. But I was taking like 5 milligrams, just weaning myself off, and within a week or so I got off of those. And then I got off, and then I started, because I hate taking medicine, so I just wanted to see where we could go with this. And so I started weaning myself off all the other meds of the Crohn's, and I was still fine. No bleeding, no nothing, no pain, no frequency, no urgency, no symptoms at all. And I promise you, if they were to do a colonoscopy on me now, I would be completely healed on the inside, whereas before I was a mess. And after about 6 weeks, 2 months, I said, I'm going to get off the naltrexone and just see, because I have the pills here. I can take them anytime. And I got off of them, and I never have had to take another one. They're in my nightstand, but I don't take them because I'm fine.
Really?
Yes.
That's amazing.
And then I told you in my email to you, I tell anybody and everybody that I think would be interested about this, because it appalls me that the medical community does not know more about it. It's just ridiculous, because it's a cheap drug, it has no side effects, it can't hurt you to try it, it doesn't mix badly with other drugs for the most part. It's a win-win. And I told my dental hygienist is a lovely lady whose daughter is in her early 30s, I think, and has Crohn's and is very sick with it, and her daughter is a nurse.
Nice.
And I told her that the mother of this daughter, I told her about what I've just told you, my whole spiel with the naltrexone, and she could not get her daughter to take it, because her daughter was saying, well, that's a drug for heroin addicts. And I explained, I said, that is at 50 milligrams. Yes, they give it to you if you're ODing on heroin, of course. However, in low doses, it somehow just lets your body flood with the endorphins that it needs to flood with, and whatever. I don't know what it does. I'm not a doctor, but it works. And I explained this to her, and her daughter finally, reluctantly started taking it, and my husband just went and had his teeth cleaned 2-3 weeks ago, and the mother told him to tell me that her daughter is doing remarkably better.
It's amazing, isn't it? And I find it amazing as well that you don't have to continue taking the LDN. You know, it's done its job, and it's still continuing to work, yeah.
Right.
It's amazing. But I suppose you've got it there. As soon as you notice anything not quite right, you start taking it again, I presume.
Yes, ma'am. That's exactly what I would do.
Yeah.
And my thing with my Crohn's is I just start bleeding. You know, I'll go to the restroom and there'll be some blood, and that's how it started. And that's like the first thing. And I know it's coming back, and that'll be the first symptom. And if I ever do, I'll just start taking it again. But I haven't had any. And I go poop once a day, twice. You know, like a normal person.
Yes.
I'm like a completely normal person.
So how long has it been normal now?
Let me see. I got the bottle right here. I'm not good with dates and time, because I'm old and everything seems to me like 5 minutes ago. Okay, I had this filled August of last year, the last time I had it filled. So this summer it'll be a year that I've been off of it. So many months, a good 8 months at least.
Well, thank you very much for sharing your story with us.